Surrogacy is one of the advanced reproductive techniques wherein a woman rents her womb to another couple for the delivery of their child. This technique is a boon for the couples who are incapable of giving birth to the child because of many reasons. For example, females having problem with their uteruses, like the uteruses being distorted by many fibroids, or if the uterus lining, that is the endometrium, has been damaged by infections like tuberculosis or any other, or if there are multiple IVF failures in spite of good embryos being transferred all the times. In all these cases, the woman is not able to give birth to a child. Such kind of couple can be helped with this special technique which we call as surrogacy. At times, the woman is not medically fit because of medical disorders or some psychological problems that they cannot carry 9 months pregnancy. Such kind of couples can also be benefited with this technique of surrogacy. In surrogacy, we cater not only to the Indian but also the couples from other parts of the world like America, Canada, Australia, UK. From last 3-4 years, the couples coming to us for surrogacies have been increased. The reason for this primarily being, number one, that we are as good as the world's best centers in terms of technology, equipments, techniques and personal experience, and the doctors catering in the services. Secondly, the most important thing is that we are provided this service, which is the world-class services at the rate which is approximately 1/7 to 1/8 of the cost in other parts of the world, and almost cheaper in other cities like Mumbai or Delhi in India. And third, and the other important thing, that we are strictly following the ICMR guidelines for all medical and legal implications involved in surrogacy. We are following these guidelines not only for the selection of the woman who can be a surrogate, but also for the couples who are intended to take help of this surrogacy. We are following all the guidelines very strictly for Indians as well as the international patients who are coming for these techniques. Like we tell them before coming to India that they need to have a medical visa before opting for this service. They need to follow certain rules and regulations that we provide them through mails, like they need to have a certificate from their treating physician in their respective countries that they are really in need of surrogacy. They should have a medical visa. Third, when they are coming to India, they should get themselves registered with FRRO. And another important thing, that they should undergo a psychological counseling, that after the delivery of the child, they are able to take good care of the child being born out of surrogacy. And another important thing is that we make it a point that from wherever the couple is coming for this treatment, the surrogacy should be legal in their country, so that at the time when they are taking child back to their country, they should not find any problem with the visa. After complete medical health checkup, we go for a psychological counseling of the surrogate mother by an experienced psychologist, wherein we make it a point that the surrogate should know what exactly she is going for. She should be comfortable during the procedure, as well as after getting pregnant, she should be in a position to take care of herself completely. And once she has given birth to the child, she should know that she is supposed to hand over the child to the intended parent, and she should not be emotionally very low at that time. For this, we make it a point that we involve an experienced expert psychiatrist or a psychologist into the counseling. And India is now becoming a hub for surrogacy over the international market. There are many reasons for that, but the two important reasons being that India is at par with the world best centers in terms of the assisted reproductive techniques, in terms of the equipments, technologies, as well as the capabilities and the experience of the doctors or the staff involved in assisted reproductive techniques. Secondly, these world-class services are given in India at much affordable rates, which are approximately 1/7 to 1/8 of the other uh, countries. And in surrogacy, as we know that India is doing very good in surrogacy, now there are certain guidelines which has been put forward by Indian Council of Medical Research to safeguard the interest of the surrogates as well as the couples who are coming from abroad for this treatment, so as to avoid any kind of problem during and after the treatment. If we talk about the legal aspects in surrogacies, then we follow all guidelines while doing surrogacies. The important being that an agreement which is notarized is signed between the intended and the commissioned parent, so that any time during or after the procedure the interest of any of the parties is not hampered. Secondly, if the couple is coming outside India for this treatment, we make it a point to follow certain checkpoints, like first and important that the surrogacy, whether it is legal in their country or not. Second, whether there has been given an appointment by their, whether there has been given a letter by their treating physician that they are really in need of surrogacy or not. Third, they are on medical visa to India or not. Once they have followed these major formalities, they are called in India, where they sign an agreement with the surrogate, and thereafter we start the treatment. And this is being done once they get themselves registered with the FRRO. And after the treatment getting completed and the child is being born, again we follow their country guidelines as well as Indian guidelines to make sure that the child is handed over to the intended parent in less troublesome and as quickly as possible.